This video is how to make condensed notes, and it comes from a viewer asking me to explain how I actually do my condensed notes. So first of all, this is me as a freshman at Stanford University. Here I am at 60 years old. So from here to here is 42 years of life. Okay, and I know I look pretty old, but I look young for 60 to people who see me in real life. They say I look like I'm about 45. All right, so anyways, here I am. I got the calendar. I'm way off at Stanford. I was from the Midwest, so it was far from home. I missed my girlfriend, my family, my friends. I hated it. I was so lonely. And also I was recruited as an athlete, so I had never taken school that seriously before. And all of a sudden I'm in classroom competing with kids that are all, valedictorians, went to East Coast prep schools and stuff. I got like B- as my first quarter. They're on a quarter system rather than a semester system at Stanford. So I had to rapidly improve my academic ability. And the key thing was studying study skills. Luckily, I found a guy who was getting A+ in difficult classes, and I just asked him, show me how you do it. And I just copied. He taught me everything he did, and I just imitated him. And then I started to read everything I could on study skills. Okay, and we're going to talk about condensed notes, a great version of study skill. Oh, there's another thing too. Because I'll sometimes teach students and they'll say to me, oh, well, not everyone does this. Lots of kids are smart. They don't do that. And there's something called Stanford duck syndrome. Stanford duck syndrome means that above the water, the duck acts like everything is cool. But below the water, the duck is paddling furiously. And that's pretty typical of college and grad students. They try to act like it's cool, but they're actually, really working hard and trying to push themselves, but they pretend they're not. Okay, here's just a couple more books I've written just to give you a little bit of perspective. Medical Students Board top board scores. I graduated first in my class, 333 students, 99% boards, med school and residency. And then I wrote this other book, Straight A at Stanford and on to Harvard. I ended up going to Harvard for an imaging-guided surgery, interventional radiology fellowship. Emersys Elsevier is the best textbook company in diagnostic radiology, interventional radiology. I wrote the textbook for them on imaging-guided surgery. Top 100 procedures in interventional radiology. And then I also, after I raised my kids and I studied everything, I have the best theory in the world for what causes brain damage, in terms of the supply and demand theory. So anyways, and then also after teaching my kids and tutoring on some kids and college students and stuff, I kind of got more and more of a perspective. I also had done a lot of tutoring as a medical student. I tutored the whole urban health program and stuff and was a regular tutor as well. How other people think, not just myself. Okay, so anyways, here's an example of my condensed notes, and I like an outline format. An outline format means that it's easy to find everything later. These little boxes are where I've cross-referenced topics from other books. The purpose of condensed notes is so that you've got everything in one location. You want everything in one location because you're going to hit crunch time the last 2 weeks before an exam, and you don't want to be chasing information all over the place. You want it all in one spot, and you should know where it is. And the way you do it, for example, you review with a question book when it's time for your midterm. Well, you keep that question book, and you review your question book questions again when it's time for the final. And then you'll have a standardized test typically, at the end of 2 years, and at the end of the second year in med school is when you take your boards. Okay, so now you'll have reviewed that question book 3 times, and you put the relevant information into this condensed notes. Everything's always going into the condensed notes, so it's all in one spot. I also will want it to have an index at the back of the book to make stuff easier to find. I'll sometimes put little post-its in there. I'll highlight the book. I'll put mnemonics in the back of it usually. Sometimes I'll fit them in. Okay, let's see here. Let me get to the page. Here we go. Here's some of my notes. The rationales to get all the information in one place. Helps a lot, especially when you're in crunch time for the test. Index at the back, tabs on the side. I'll start showing you what some of my condensed notes look like. This is my diagnostic radiology boards. You can see the book was so torn up I had to tape it back together. Just on any given page, you'll see tons of highlighting, handwritten notes inside there. And that's how it works. I was done in an hour and 10 minutes with a perfect score on my residency boards. Here's my fellowship boards. I took this surgical book and I just converted it into head and neck anatomy. Head and neck anatomy is one of the more challenging things to learn in neuroradiology because it's quite complex and there isn't any single good textbook. So I decided to, in a sense, make my own textbook. I would just cut the pictures out of all the journals, anatomy atlases, and other textbooks and put them into one book. And that was my book. You can see I have all these tabs on here so I could find everything real quick. You know, it was almost like an experienced musician playing a guitar. I knew where all these tabs were quite well. And I was also told at the end of this test, you know, the examiner kind of like freaked out. He's like, where did you train? Where are you from? How did you prepare for this test? Your performance was extraordinary. And this is just what I did. So I just basically, I would memorize these pictures. Oh, if you looked at that earlier picture, if I showed you that straight A at Stanford picture from the book cover, that was what I used when I was studying for boards. Let's see here. Yeah, here it is. So you can see, I would tape all the pictures of neuroanatomy to the wall in my bathroom when I was studying for boards exams. So it was all there. I'd walk in the bathroom, then I would just turn my back to it and I would say out loud everything that was in it, and that was a good way to memorize stuff. Okay. Whenever I take a study break, I do a self-test walk and talk. You know, I close the book, I'm going to the bathroom, I'm doing my laundry, eating lunch, whatever it is, I start talking to myself about whatever I just saw in the picture. You know, this is the oral cavity. This is the oropharynx, okay? And what are the different parts? Here is the lingula. You know, I would go through the uvula. I would go through everything and just be able to say it out loud. Then you remember everything. That's how you do it. Okay, this is something from my illustrated condensed notes. You can see I taped these pictures in here. I put in all kinds of text in there to describe them. And you just build up a lot of familiarity with it. Here's all the tabbed indices in the book. Sometimes there's a post-it. You have to do something different to remind you, you know, what's special while you're saying. I put all these mnemonics in the back of it. So once again, the whole point of it, as you can see, I've labeled these mnemonics. I had like over 600 of them. Here's number 298, number 297, 293. So number 300. So all of these mnemonics would help me remember all these diseases. That's how I did it. And, you know, and it works. These are very effective study skills. I'd say the most powerful study skill you could have is walk and talk self-test, where you just talk to yourself. You take the book, you close the book, you leave it on your desk, and you start talking to yourself. Can you recreate the whole situation? Because if you can recreate everything, articulate, you have to reconstruct all that information, put it all together in chronological, functional order, then you know it pretty well. It's a much higher level of knowledge compared to the average student who just highlights and tries to memorize their highlights. That's sort of simple recognition versus ability to articulate. Then you hear yourself say it all, you know that material much better. And that's what I've seen is A-plus level students at Stanford, we could articulate. Because I hung out with some guys who are really good students then later, and we would talk about stuff versus most people just study on their own. They don't ever articulate the material to them. When you think about it, if you're ever going to be good at anything, you have to be able to articulate it. Okay, somebody comes up to me and says, hey, here's a brain MRI. This patient's very sick. What do you think's going on? I don't tell them, oh, could you please, you know, give that question to me in a Scantron and multiple choice exam? No, I got to look at the films, articulate the findings, correlate that with the clinical history, and come up with a reasonable differential diagnosis and a treatment plan. Okay, that's what you do. So anyways, that's condensed notes. Hope that was helpful.